fantastic turnout. Can you hear me okay? No. Is this? It's just for LCTV. Oh, that's just for LCTV. So I will try to speak louder. How's that? That better? All right, so all of our speakers, you got to talk loud because I think your voice goes that way instead of that way. All right, well, so I'm Cindy Wade. I am fortunate enough to be the president at MaineHealth Lincoln Hospital and get to enjoy oversight of all of our senior living facilities, which this is one of them, one of our most beautiful ones. And I am here to welcome you to our Booth Bay Community Committee meeting. We get to do these periodically, and a lot of you are familiar faces, so I know a lot of you are here frequently with us, which is fantastic. And we love to bring you updates. It is a meeting to communicate what's going on in the organization, some of the outreach we're doing, the work that we're progressing on, and so it's really a meeting for you. So anytime you have ideas or thoughts about things you'd like to hear about, we're happy to try to accommodate that and get speakers or get information so that we can present that at the next meeting. It's really important that we're updating you at any given time about what's happening. Just a couple of things going on. I think people are well aware that there's constantly change afoot, and so we're trying to navigate what's going on in the state and what's going on federally. I think if you're paying attention to the news, there's a lot of things happening, and I was just having a conversation before I stepped over here to welcome you all about just we've got our eyes on what's going on here locally, but really what's going on across the state of Maine, of course, because we're very concerned about that around healthcare and healthcare access. But Maine is not unlike what's happening across the entire nation. And we were just talking just recently, there have been a lot of closures of a lot of different services across our country. And there's a lot of reasons for that. But I guess I would say one of the most impactful is the reimbursement that healthcare facilities receive from government payers especially. So here in the state of Maine, there's a lot going on with our government here locally and what's happening around MaineCare and the MaineCare coverage of people in our areas. And so with that, we'll see less people covered and less reimbursement for people being covered because they will be out on their own. And insurance is so expensive that people are struggling to be able to buy insurance in other ways. And so as we see that unfold, that's going to cause a lot of health issues for people that have been covered that will no longer be covered. And it will then cascade into people trying to access care. And unfortunately, we've seen through history and through what happens is people then have to access care at a higher level, which is in the emergency room, when unfortunately we would hope that they could get that care in primary care. So this is a continuous snowball that's gaining a lot of impactful, it's like an avalanche a little bit. And we're trying to mitigate and have that snow redirected in this avalanche that's coming towards us. And across the country, everybody's feeling the impacts of what's happening in the federal government, and reimbursement for healthcare organizations will be impacted through changes there as well. So what's that mean locally? That means we're really paying attention. We are looking at how is that impacting us locally? What are we looking to do? What are we doing as a system? You know, we work as a region, so I'll remind those that don't know or that have heard it, but those that maybe don't know, MaineHealth is a pretty big system in the southern mountain region, coastal region, and we impact a lot of lives across the state of Maine. So we work really closely to try to make sure that we can form partnerships in order to provide access to care. And we do that really closely with our regional partners, and we're part of what's called a coastal region partnership with Mid-Coast Hospital, Lincoln Hospital, Penn Bay Hospital, and Waldo Hospital. So we work really closely to make sure we're maintaining access as close to home as possible in our region together. So just really focused on what does that mean, how do we make sure people can get what they need. And you may go to Midcoast to see cardiology, you may go to the Dambriscotta campus to see cardiology, you may have to go to Penn Bay or Midcoast for urology services. So we're navigating that so that we can be ready for big changes. And why is it so important around, the federal and the state and how we get paid? We are about 72% MaineCare and Medicare in our population, and that's who accesses our services. And we get about 27 cents on the dollar reimbursed for anybody that has a Medicare or MaineCare services. So we have to figure out how to make that difference up. So we work really hard as a region and as a system to make sure we're paying close attention to that. And unfortunately, things are getting harder and harder. For those of you, I know a few people in the audience got the opportunity to hear Katie Fulham-Harris. She's our Chief of Government Affairs, who spends a lot of time in Augusta with Holly and others, as well as Washington with Holly or with Senator Collins and other folks in Washington talking about these issues and these concerns. But today, we're trying really hard to provide what's most important, which is health care to our communities and provide beautiful facilities such as this to our communities. And because we all need behavioral health integration, and more people need behavioral health, we have a fabulous program here. And we have Stephanie Fields, who's going to talk to you a little bit about what that looks like and how many clinicians are actually working together so that we can provide high level care around behavioral health services. So Stephanie's going to speak to us in a few minutes. And then we have our very own Christina Verney sitting here. She's a program manager of community health, and she's going to talk about food insecurity and how we're trying to mitigate, because food is very important to health and wellness. In our community, there's a lot of people that don't have enough food to take care of themselves and their families. And so what are we doing around that? And then Sarah Watts is going to talk to you about MyChart. Sarah is a medical assistant here in Booth Bay at the Family Care Center, and she's just a whiz when it comes to our MyChart. And she's going to talk about that and hopefully give you some tips and tricks of how to use your MyChart to your benefit. So it's kind of a jam-packed agenda. But getting back to my earlier conversation, I think we will continue to bring people like Katie Fulham-Harris, who works really hard for us around all these things that are going to impact us, sometimes positive, but a lot of times it's something we're trying to mitigate and impact the negative in a different way. And we can look to have Katie come in the future to come to Booth Bay. She was in Dambriscotta this month, and Booth Bay in the future, so that you can hear directly from Katie and all the work that's going on to help us level out what's happening in the world of reimbursement and impact from both in the state and federally. Oh, you can watch Katie. That's sorry. Thank you. That's a nice infomercial. I should know that because I'm standing right in front of the LCT camera and microphone. But we did tape that. That is taped. It's on LCTV. But I also think it's nice because there may be more questions that come up. So we will look to see if we can get Katie in a future conversation. Yes, sir.
You were originally part of the agenda to do MyChart, but that's passed on to the other personnel?
I'm not doing MyChart. Sarah's going to do MyChart.
The original agenda was you on.
I'm on to welcome. Sorry.
For this agenda, previously, the first agenda we got had you as
Okay.
my chart person.
I can speak to you about MyChart, and I know how to access MyChart and navigate MyChart, but Sarah is the one that's going to be able to give you really some tips and tricks around it. She's an expert in MyChart, and she's going to be much better versed to help you answer your questions. I'm going to be here, so if there are questions that I can help with.
But I have other questions too.
Sure.
About the background of why we had to change everything here on the doc thing. Why we had to change everything.
I'm not sure. I don't know if the doctor.
No, the doc.
Oh, on MyChart?
No.
Why we've changed cable TV channels? Here in the building. I'm not sure. I will go find out that answer while we're talking about these other agenda items, and when I come back, hopefully I can have an answer for you. How's that?
Well, but I really want to discuss it with someone.
Okay, perfect. We can do that. We can do that.
Because well, they imposed that on us for whatever reason. I'd like to find out what the reason is.
Okay, I can help with that. I will see what I can find out, and we'll come back to you later in the morning. All right, well, so I have the privilege of asking Stephanie Field to step up. Thank you for joining us, Stephanie, and we look forward to hearing what you have to say.
Thank you. Okay. Hello, hopefully you can hear me okay. I'm Stephanie Field. I'm the program manager for behavioral health integration. And I'm here to talk about the history of our program and the scope of care. And we're also lucky to have one of our clinicians on our team, Lisa Carboni, who you may all know from her time here on Thursdays. So, all right, next slide. Okay, so over the past 20 years or so, really the first point of contact for folks experiencing a behavioral health issue is overwhelmingly their primary care provider. And so in 2006, in response to that, MaineHealth entered a collaborative to expand behavioral health services into primary care. And actually, I started with MaineHealth in 2007, and my first position was here at the Family Care Center. I was hired by Peggy Pinkham, if folks remember her. She was a real trailblazer in wanting to bring behavioral health services into primary care. So, and then it evolved into, as various health systems came under MaineHealth, so the different mergers, BHI, as we're called, became a standalone program. And so versus just a collaborative, we actually became a program where people were hired into it and we all started working together. And so today, in 2025, which is hard to believe, we have over 100 clinicians across the BHI program, and we're in every single primary care practice across MaineHealth. So that's from Sanford to Stockton Springs to Farmington to Norway. And we're also we're in every primary care setting, and we're in many specialty care practices. So neurology, cardiology, oncology, weight management, pain management. You might see one of us in that practice and available to you. Yeah, next slide. So what do we do, right? So behavioral health integration, what is that? What it really is in a nutshell is there are licensed clinical social workers like myself, like Lisa. We also have licensed clinical professional counselors. We have psychiatrists, we have psych NPs, we have psychologists, and we're all integrated into primary care. And we get all of our referrals directly from the physicians or nurse practitioners or physicians associates. And so common reasons for referral are depression, anxiety, trauma, which is a whole range of events someone could have experienced, grief, stress, including caregiver stress, chronic disease management, so we can help support folks who might be struggling managing a chronic illness such as diabetes, COPD, congestive heart failure, because we know cardiac issues, because we know managing a chronic illness can lead to feeling overwhelmed, discouraged, you can feel burnt out by it, so we can help support folks who are living with a chronic illness. And then, so we also treat children as well. So, we definitely, we really treat the lifespan. So we actually get referrals for even kids under 5 who might be really struggling. And we want to be proactive and help kids and families develop some good skills to maybe help them improve. And so we see a fair amount of behavior disruption in children, ADHD, and then we know incidents of anxiety have really increased in young people with the advent of social media, just to be honest. So those are all the reasons we might get a referral from a primary care provider. And so then how that works is if you're visiting with your primary care provider and you start sharing different stressors, or you probably have all filled out one of those questionnaires asking you about your mood. Yeah. We even send them out on MyChart now. And if the score is high, they might ask you if you're interested in meeting with one of us. And they might even bring us into the exam room and introduce ourselves during that visit. And you could even schedule an appointment as you exit. So we try to be really, a big part of our role is having good access. So we're always taking on new patients and want to be available to folks. Okay, next slide. Sorry, some of this might be small, so my apologies. It's hard for me to see it. Okay, so I just talked about what's called a warm handoff. So that would mean you're visiting with your primary care physician and you're struggling with something emotionally or just stress, and they say, here, I'd like you to visit with, or introduce you to Stephanie. So I actually still see patients in Damariscotta on Wednesdays. So I do this. So I'll go in and introduce myself, explain a little bit about what I can offer, see if you're interested, and then even encourage you to schedule a visit with me as you exit. So, or Lisa does that at the Family Care Center. In here too, probably, yeah. So then we, sort of our model of care, it's episodic and targeted, meaning because we're always taking on new patients, we have to always be ending with patients because then we get what we call bottlenecked, and then we're scheduling out too far out for first visits. So we really want to focus in on what is your presenting concern and how do we hone in and target that and really get working on that so we can help improve your daily life. And so, and as symptoms decrease and functioning improves, we might back off on visits and actually go to a, hey, just call me if you need me, and I'm a part of your care team now and know I'm here for you. We then, part of our work is we create an individualized treatment plan so that we know what we're doing together, and we know like, oh, hey, I think we're at the end of our work, you achieved your goal. We also link and refer folks to other needed services. So if we meet with somebody and we assess that, gosh, they really could use more than what we could offer, we really try to help link you to other services. Though, you know, the reality is, unfortunately, what's available outside of primary care has shrunk through the years, and that's really why primary care has expanded, because there's been a need. So we do our best with what is out there for resources. And lastly, part of what makes our role, well, there's lots of things, I think, what makes us effective, but one of the things is we're really able to partner with your primary care physician. So we're really working as a team to meet your needs. And so we document in the same medical record. We can route our notes to the physician or and advanced practice, or APPs we call them. And we can even say like, hey, they're really struggling. They might need to see you to the physician. Maybe they could schedule a visit to do a check-in. Maybe you can talk about their medications. So we really work closely together to make sure we're meeting patients' needs. All right, next slide. Right, so Lisa. So Lisa now offers BHI services right here in this building. Right, this building? Okay, I want to make sure. On Thursdays. And so if you are interested in anything I've just shared with you, if you think, oh gosh, I could use some support, you can reach out to Lisa directly, or you can call your primary care provider. You can MyChart them. So what we do need a referral to see folks, because that enables us to bill insurance. So if you're interested in the service, again, you can reach out to Lisa directly or call your doctor or MyChart, And maybe Sarah can show you how to my chart. Okay, next slide. I also just wanted to share that we, in addition to meeting with folks individually, we also offer support groups and some therapy groups, because we know it can be really effective meeting with others that are maybe struggling with a similar issue. And so these are all the different support groups we offer across the Lincoln County community. And I know not everyone uses QR codes, but it is pretty slick. I've tried it. If you, it actually brings you to the MaineHealth website, and then you can get further information for each group. But I also have some information on each group in the following slides. Okay, so we offer 2 Life After Loss grief support groups for the community, and these are free. We don't bill insurance for this. We don't, yeah, they're open to community members. And so Lisa facilitates one group. It meets the 3rd Thursday of each month from 4 to 5 at the Cochrane Conference Room at the, I still call it the FCC, though, right? And we just ask if you're interested in attending to reach out to Lisa so that, you know, she can just give you some specifics and just discuss with you, you know, what's going on for you personally. Then Lori Stetson, who's another clinician on the team, offers the same group. It's the 3rd Tuesday, 4 to 5, and that's at the Watson Health Center in Damariscotta. Okay, and then this is a group that was developed by a couple of clinicians on the team several years ago, one of whom, though, has retired and has attended the group herself now as a participant. It's called Resilient Seniors. This is open to anyone who identifies as a senior or cares for seniors, provides education, support, connection, and that's facilitated by another clinician on our team who's located in Wiscasset, Amanda Armstrong, but it's held at the Watson Health Center Community Room in Damariscotta. Again, that's free. It's welcome to anyone in the community. You don't have to live in Damariscotta. It's open to anyone throughout Lincoln County. And that goes, it's the, no problem. The 2nd Thursday of each month from 10 to 11:30. It's hard to keep track of all when they are, so that's why we've created some flyers, and this is all on the MaineHealth, Lincoln Health, or Lincoln Hospital website. It's hard for us to remember the name changes as well, if that's any consolation. Okay, and then next slide. And then we have a caregiver support group, and this again is a free support group, and it's really to provide support to folks who identify as a caregiver of any person. And so that's again facilitated by Lori Stetson, and that is the 2nd Friday of each month from 1 to 2, again at the Watson Health Center in Damariscotta. And next, okay. And so, and this is just, I wanted to show some data over the last few years. Okay, let me get my bearings on it. Okay, so this is 22, 23, 24. The bottom line is the total number of visits scheduled. And let me just back up and tell you, and I have a slide that shows all the folks on the team. So this is data that includes, of course, the Booth Bay practice, the Wiscasset practice, the Damariscotta practice, the Waldoboro practice, and then Women's Health in Damariscotta. And our school-based, Annie Pat and Mindy. We also have clinicians in every high school across Lincoln County. So we're at Lincoln Academy, we're here in Booth Bay, we're in Wiscasset, we're in Madomic, and we're also in Morse, which is Sagadahoc, but we're there too. So that includes this data includes all the patients we're seeing in all those settings. So in 22, we had nearly 8,000 visits in 1 year. So that's how many patients. So not all, they're not in 8,000 individual patients, so some people we see more than once, but we had 8,000 visits. Then, oh, no, excuse me. That was visits scheduled, that's visits occurred, so the difference is between cancellations and no-shows. So we actually had almost 7,000 visits. Okay. And then we had almost 1,000 new patients. So that's, in 1 year. So then if you look in 23, we had over 8,000 scheduled, about 7,500 occurred, and we hit the 1,000 mark in 23 of new patients taken into the program. And then in 24, we hit 9,000 visits scheduled, over 8,000 occurred, and we're a little over 1,000 patients, new patients. So you can see we're growing in terms of how many folks are accessing our services. And then, next slide, I think. Okay. So these are all the clinicians located in the various practices. So, Damascotta is a pretty large practice, so there's several of us there. So we've got Lori Stetson, who primarily sees adults and is full-time. Dina Slinger primarily sees pediatrics and is there full-time. I see primarily adults, but some children, and I'm there on Wednesdays. We've got Dr. Cobble, who's a pediatric psychiatrist. He's there 2 days a week. And then we've got Sarah Patton, who's an adult medicine psychiatric nurse practitioner, and she's there 2 days a week and does some work remotely as well. And then also in Damascotta OBGYN, we have Kim Starbird, who's there part-time. We've got Lisa here in Booth Bay, full-time. And then next slide. We've got Amanda Armstrong, full-time in Wiscasset. We've got 2 clinicians in Waldoboro, Kathy Ames and Brenda Hamilton, and probably know that Brenda actually right now is at the Penn Bay Waldoboro office, but soon to be merged at the new site on Depot Street, and that's will be under Lincoln. And then these are all of our school-based health centers. So Heather Norris is in Booth Bay, Lincoln, and Morse, and Lisa Allen is in Madomic High School, Wiscasset Middle and High School. Next, I think that, and thank you. Thank you. Yeah. Oh, any questions, thoughts, feedback, observations? No.
Does Michael's phone not work?
It's only really for LCTV, so apparently not, in terms of, like, the room.
I can hear you.
You can?
But I can't always understand what you're saying.
I'm sorry.
Well, it's like
Aging's rough, right? I hear you. Okay. Oh, I will sit down then. Thank you for having me.
I also was thinking with all the pictures, I can just flip through easy anyway, so keep saying next slide. Thank you. It's very small on my side. That's okay. Okay, good morning. I am Christina Verney, and I'm the program manager for community health at MaineHealth Lincoln Hospital. And I was invited here to TED today to talk about my work on food security initiatives and some care team wellness initiatives that we offer. So to start, I'm going to talk about some care team wellness initiatives, and then, like I said, I'll move into our food insecurity and our Help Yourself shelves work. At Lincoln Hospital, we have a team called Works on Wellness. There's a system across the system. There's a wellness team at every hospital, and ours consists of about 20 care team members. and it's a variety of, we have physicians, we have nurses, we have some pharmacists, and then people from various different departments. And a purpose of our wellness team is to have people participate in wellness initiatives, so things that are fun, things that are healthy. That can include physical activity, some various healthy eating options. And so we offer various initiatives throughout the year, but the two that I'm going to cover today is our community-supported agriculture, so our CSA programs and our summer wellness gardens. So CSAs, if you're not familiar, stands for community-supported agriculture. So many local farms offer community-supported agricultural programs throughout the summer months and the winter months. And it's a really great program for them to have people sign up as sort of a commitment to purchase food from them throughout the summer. So the sign-ups happen generally in the spring, so right when they're starting to plant, right when they're starting to purchase all their seeds and get their farms ready. So we have been fortunate to have some partnerships with, right now we have 7 different farms that we work with locally. We don't have any in Booth Bay, but we do have a lot of farms that bring their produce down to the farmers market here in Booth Bay. So if anyone knows of any farms that want to partner with us from Booth Bay, we would love to put them on board. So the way that it works is we start in the spring, and I reach out to all the farms that we partner with, and we set up, we find out if there's any updates, any pricing changes, anything like that. So I compile a list of all the options that our employees can sign up for. We promote the program, and we typically have anywhere between 200 and 300 care team members that are all primarily from Lincoln Hospital that sign up for it. They can sign up for one farm, multiple farms, and any amount of money that they want to spend towards the farm. So that happens in early spring. And I've got here the list of farms that we have. I'm not going to go through them because I know I have a lot of slides here. But so this past year, between the summer and the winter CSAs, we had employees sign up for a total of $68,500, which all got put back into the community. So it goes to the farms. And then, like I said, when summer comes along, our employees can go out and start using their CSAs at those farms. So they can choose wherever is convenient for them, whatever is closest to their house or work, or whatever works the best. So, and then we actually, the farm we partner with in the winter months, they deliver their box of produce directly to all of our locations. So Wiscasset, Waldoboro, Booth Bay, and 2 different locations in Damascotta. So it's a really great program, and we are super fortunate to be able to have this partnership. And it actually is pretty unique to Lincoln Hospital because we do have so many farms around that are willing to work with us on this, and it's a huge benefit for them. So the next thing I'm going to cover is our WOW Wellness Gardens, so our works on wellness gardens. So throughout our Lincoln Hospital campuses, we have 18 raised bed gardens, and I'll go through the different pictures of what they look like at each site, just to give you an idea. But we have those at Watson Health Center in Damascotta. We have them at Cove's Edge, outside of our surgical services and OB practice. We have them at Wiscasset, Waldoboro, Booth Bay, and outside of our wellness rehab Van Winkle building. And so again, it's all organic, veggies and herbs, and then, you know, there's pretty typical veggies and herbs that we grow, but sometimes sites have unique requests of what people are looking for, so we try and accommodate that. So the gardens are all maintained by, usually it's members of our WOW Council, but any care team member at our sites that want to take care of the gardens, that's who does it. So we do all the planting in the spring, and then they maintain them throughout the summer. The produce gets picked and labeled, and we put it out to any patient or care team member that wants to take it. So, like I said, I'll go through the pictures of what we have, but so you'll see each garden setup is a little different just based on the space that we have available. And and the sizing. So this is at the Watson Health Center. So these are 2 waist height beds, and these are probably our best growing gardens that we have. They're front and center to everyone that walks in. And they are taken care of by one of our physicians, Tim Goltz. So that is his project, and he does a great job. Then we have 3 beds outside of Cove's Edge. Myself and my team took care of those this summer. Unfortunately, they got eaten by deer pretty early on, but that's living in Maine. Then surgical services team, so they have their beds, their garden beds are kind of hidden, but they have some V trough beds out there, and they grow a lot of produce, and that is all available to anyone coming and going from surgery. So they have some awesome beds there, and the patients really appreciate that as they're leaving. Then we have our beds at the primary care office in Wiscasset, so pretty basic, 3 beds out there, right next to the road, but they look nice. And then in Booth Bay, we have sort of a unique setup, but there's not a lot of space over at the FCC or primary care building, and so they have done sort of this unique situation of bucket garden beds. So maybe someday we'll have some bigger beds there, but that's what they're working with now. And then Waldeboro, they get our golden star for the summer. These were veggies from 3 days ago, I think. So they've got some beautiful cabbages growing, peppers. They have 4 beds there, and they have a lot of patients actually that walk out behind the building to go help take care of them. So they're very passionate about their gardens. And then this is just some examples of our distribution. So we've got some basic shelving, and everything's labeled. It's either on a table or it's on the shelving, and patients can help themselves. So that's just the 2 things I wanted to highlight for sort of our employee wellness, and then the other half of what I'm going to talk about is food insecurity in Lincoln County and what we're doing to work on those initiatives. So some just overview of some data, state of Maine data. So 13% of Maine's population is food insecure. 1 in 8 Mainers struggle to find room in their budgets for food. 1 in 5 children are facing hunger. And pretty alarming is that Maine is ranked 21st in the nation and 1st in New England for household food insecurity. So then specifically to Lincoln County, about 12.5% of individuals in Lincoln County are food insecure, which equates to 4,470 individuals, and 19.5% of those are children. So we know that this is a problem. There's a lot of factors in that, and so we had always had this as a priority, but it really came out at the start of COVID. So I wanted to bring attention to Lincoln County food pantries. We do have food pantries in Lincoln County, of course, and right now we have about 8 operating food pantries in the county. Those can fluctuate. Sometimes they close, sometimes, their hours aren't consistent, but I just wanted to point it out because we do have the pantries, but as you can see, the hours are very limited. They're pretty far in between. Some of them are only open about twice a month, and they're all volunteer run, so they're not able to have them open more often. Limited hours, it's hard for people to get from one place to another. If you think about people living on like Westport Island, like their closest one is Wiscasset, and they may not have transportation. We don't have public transportation. So we knew that it was a problem, and so we just wanted to see what we could do at Lincoln Health to sort of start something new. And we were fortunate, at the start of COVID, we started a partnership with Ecumenical Food Pantry in Newcastle. So what happened is the food pantries were getting a lot more funding and a lot more food was available at that time, but they were not seeing any increase in patrons coming to those pantries, and specifically that one. And so we sort of said, can we do something at the hospital? Because we're still open, we're still functioning, and we have patients coming in that need medical care. So we we're able to start what we called the Help Yourself shelves, and we started at Watson Health Center in Damerscott because it was close by to Ecumenical, which is in Newcastle. And so we started out by just, they would order the food, we would go over, we'd pick it up, we'd bring it over, we'd set it up on shelves. Then it was, of course, a huge success. People were really excited about it. And then we started to receive some grant funding from Good Shepherd. So Good Shepherd at the time was covering food costs, and we were able to have the food directly delivered to us at each building. So we didn't have to continue to do the driving it back and forth from the food pantry over to us. So we did that, and then we were able to get funding for shelving, and then we said we need to expand this to all of our practices in Lincoln County, because just because it's in Damerscott, it doesn't mean somebody from Wiscasset and Boothbay can get there. So we were fortunate to be able to set it all up in each of the practices. And so we kind of called it a Help Yourself shelf because it's destigmatizing, and we just thought of it as people are there, it's convenient. We don't collect any demographics. There's a paperwork there that somebody can write down how many people are in their household, but it is voluntary. It's just there, but we don't have to collect any other information. People don't need an appointment to go to our shelves. And they're strategically placed, so they're front and center as you're coming, as you're going, each of our practices. So again, we have those in each of our locations, plus at the Van Winkle building for summer produce, and then in surgical services for the summer produce. So since we are a healthcare facility, we wanted to really make sure that we had healthy items offered. So the guidance that we sort of follow is having low sodium, no salt added, things like soups and veggies, no sugar, no sweetened fruits, any sort of snacks like that. We offer whole wheat pastas, rice, pancake mix, low sugar cereals, low fat shelf stable milks, baking goods, and then some personal care items when we are able to get those. So things like toothpaste, shampoo. And so I'll go through just some different pictures of them. You'll see each setup looks a little bit different, kind of like the produce gardens. It's just whatever works in the space at each of the buildings, but we always try and have like sort of some fun seasonal signs as we go through the different seasons, and then have them stocked with a variety of goods. So this is our one in the front lobby at Watson Health Center. And then we are fortunate at Watson that we were able to get a refrigerator. So you can see we have sort of a clear glass stand-up refrigerator. And so that we are able to keep refrigerated produce there. Our other sites, we can have produce, but we don't have refrigeration there. And then also at Watson, we have a big storage room sort of in the back section of the hallway, which makes it really nice because we only get some of this food once a month. So we need to have it stored someplace, and then we can easily shuffle it out to the front as things start to get low. This is a little setup we have in the Cove's Edge break room. It's just there for anyone that needs it. And then primary care in Wiscasset. So they have some additional items, like they have some diapers that they give away, beans, rice. So sometimes, things just look different and come in differently to each site. Waldoboro, they have a lot of paperwork, a lot of resources for people with their shelving. And then there's some produce there. This is at the primary care Boothbay FCC building. Again, produce and in some of our Good Shepherd delivery items. So I wanted to talk a little bit about some of the data we collected. This was a couple of summers ago. We put paper surveys out at each shelf, and we asked people if they wanted to fill them out. Then they were put into a raffle for a gift card. So it was totally optional, but we just wanted to see why people were visiting our shelves and not necessarily a pantry. And then also just, some demographics if they wanted to. So you could see most of the households are 1 to 2 people, but then we did have quite a high number of of 5 to 7 people and 2 to 5 people per household. So I think that was pretty alarming to us as we went through some of the data. It was like some of these households are huge. And so to have this food that's there was a huge benefit. I won't go through the details of some of the reasons for not using it, but it's a lot of the stuff that we had known, lack of transportation, embarrassed, overwhelmed. So then this slide is reasons for why people did use our shelves. Food prices are high, help stretch my dollar. A lot of people that commented they were homeless, living in cars, and they're there. They're at the doctor because they need to be. So the food is there, they're there. We collected some feedback on what people are looking for because we're always trying to expand and get what we can to accommodate what people are looking for. And then my last couple slides here, how are we getting the food? So as I said, we get Good Shepherd food once a month and it gets delivered to each site. So that's very convenient. It's all the dry goods, some produce, and sometimes some personal care items. Another great donation that we get is from the St. Andrews Auxiliary. So downtown they collect all of their personal care items, and I go there and pick those up from them, and then we put those out in the Boothbury primary care office. So anything that's unused, shampoos, makeup, nail polish, sometimes like just some really fun things that people would get really excited that it's there and different. We've done some United Way campaigns, so some food drives and diaper drives that we're able to distribute. Sometimes there's excess food from local pantries, we get that. We take donations directly at the shelf, so if some people have extra food they want to get rid of, we'll take it. We'll just make sure it fits our healthy guidelines before we put it out. Lincoln County Gleaners is a partner we get some produce from. And then a huge partner we have is Midcoast Hunger Prevention in Brunswick. So they provide us weekly with produce. And we're very fortunate, but I have to go there to Brunswick and get it, and I bring it back and I sort it. I do that weekly, and then I take it around to all of our different locations. So sometimes we get a lot, sometimes we get a little, but we will take anything we can get to bring back to the county. So yeah, my last slide is really just talking about how are we funding the shelves. So like I said, when we first started, we had grant coverage, there was excess food, and that unfortunately fell off after we moved on from COVID. And so we spend roughly $30,000 to keep this program running. That's aside from the free food that we're able to get. $30,000 covers to be able to have our shelves at each of our locations. And we know that this is a huge success. We know that it's really important. So there's no part of us that wants this to end. But we are continuously looking and seeking ways that we can fund these. In the past, we've done some employee funding campaigns. So employees have donated because they see the importance and the significance of the program. The First National Bank gives us a little bit of support through a grant. And then we have some private donations. But again, this is a really important program, and we do just want it to continue. And so we're constantly seeking ways to continue to have this happen. And so that was my really quick overview of our program, but does anyone have questions? Mm-hmm.
How often do you restock? Because when I get there, the produce is always gone.
Produce.
The stuff that's left, or the things that are in boxes.
Produce is only once a week that we're able to restock. Yeah.
That's why.
Yeah.
So I never get it.
Because we get it from Brunswick, and we can only get a certain amount, and then I have to take it to all the different sites. So, yep.
That's why I don't get it.
Typically, it's Tuesdays or Wednesdays that I'm there.
So, is there anything open every day for people who need food?
There's not a food pantry that's open every day. No.
How do you get your numbers? If you use the word decentralized, and I think that was nice. So how do you get your statistics that you're telling us need food?
Which slide, the one, the,
Lincoln County.
so that was, yeah, so the food pantries actually do collect demographic data. So those numbers come from food pantry data. The ones that we collected specifically, like household size and what they were looking for food, that was voluntary. So we just incentivized it and said, if you fill out this survey, you'll be entered for a raffle. So that's where we got some of that data. But the state of Maine data and Lincoln County data is collected through food pantries and self.
How many people are in your, how many paid people are in your program?
In my department,
Yeah, okay, in your,
I mean, working on the food, probably just mostly me and one other part-time staff. Yeah. So yes, it is a lot of traveling.
thank you.
Yep.
This one, in the Blue Bay region, there is a 24/7 community fridge that is at the Blue Bay town office, and so that is available 24/7 for anybody in the community.
Yeah, good call. Yeah.
So the information for this availability, though, in all cases, comes from Lisa.
She's your board. That's a community resources
Yeah.
council program, so it's separate
But
from what
people
people
need
need
to
to
be,
be doing.
young people here probably don't need to have that information. But people in the town,
Right.
so that needs to be advertised. Thank you.
Anything else?
Good morning. Okay, that's fine. No worries. I just emailed it, yeah, like just a few minutes ago. Sorry.
You think I'm not good on computers?
No, I trusted you. Good morning. I am Sarah Watts. I am a medical assistant over at the Family Care Center here in Booth Bay. Some of you may know me, some of you may not. I've been with the company for over 20 years, and so now I'm working as a medical assistant, and I am here to talk to everybody today about MyChart. So I'm not sure if any of you have MyChart or use MyChart, or but it is a great tool. It allows you to communicate with your provider and the provider's office, and lets you send messages. You can send pictures. There is now options to make your own appointments in MyChart. I have some things written down, so because my brain doesn't always want to work when I stand up here and talk in front of everybody. So yes, you can get in there. You can update your personal information, so things like address, name, any of those things that may have changed over time. You can definitely get in there, update things like that. I mentioned schedule appointments. You can check and see when your appointments are. Everything's listed right there for you. And we have, so you found it, I thank you. I think you did. I found a little video for everybody. There are options to pay your bill in MyChart, and you can review your balances, what your bill was for. So it really gives you a good look or a window to your chart, your medical chart. So I have found a great video that kind of gives a nice overview for everybody. So if it just scrolled all the way down, yep, keep going. This is right on the Epic website, so we're gonna go down. That's it right there. So I'll let you.
Welcome to MyChart. where you can access and share your medical record, make appointments, refill your prescriptions, and much more. I'll give you a quick tour of some of its coolest features. First, it's important to know that you can access your medical record in MyChart from the web or a mobile device. I'm going to show you features from the web, but the experience is similar from your phone or tablet. Once you log in, you see the most relevant updates and details about your health. There's a lot you can do in MyChart. Your health feed is the place to find things like new messages, payments due, and preventative care. Looks like it's time for your flu shot. MyChart will remind you of any preventative care, and you can schedule, snooze, or dismiss them in a few clicks. You and your care team can directly communicate using secure MyChart messaging. You can get an email or text to notify you when you have a new message in MyChart. But no matter what, responses appear in your health feed, and then open in an easy-to-read chat format. Go to your message center to view all previous messages or send a new one. When you choose to send a new one, you're given a list of options. To make sure that your request goes to the right place, select the option that best describes what you'd like to message about. Sometimes you can take care of things like making an appointment or refilling prescriptions without messaging and waiting for the response. MyChart will take you there. To view your recent and upcoming visits or schedule a new one, use the Visits activity. Check out your after-visit summaries to see the details of a past visit. Often called an AVS, it includes your medication instructions and any other important notes from the visit. From MyChart, it's simple to schedule a visit. Let's say your doctor wants you to schedule a follow-up in a couple weeks. Click here or search for Schedule in the menu. The To Schedule section shows you the appointments you need to schedule, including that follow-up visit. You just click Schedule and pick the time that works best for you. After it's scheduled, add it to your calendar so you don't forget. If you want to be notified if an earlier appointment becomes available, get on the wait list. Save time at the clinic by completing e-check-in before your visit. When it gets close to your visit, you can get a notification with a reminder and link to check in. Update your demographics, add any insurance info, sign relevant documents, and more. You can even pay in advance. If you have a copay due or a previous balance, you can handle it right here. Some visits may even have an estimate attached, so there won't be any surprises when you get to the clinic. You can view its details by clicking here to jump to the estimates activity. After the visit, you don't need to wait for a phone call or a letter in the mail with test results. MyChart notifies you as soon as they're available. View the results to see your findings or values and whether the results are within the normal range. From here, view a graph of past results to see how they've changed over time. A full list of your results appears on your test results page. Let's take a peek at the medications activity. You can see all of your active medications. Be sure to remove any meds you're no longer taking. You can also request refills on a single medication or multiple meds at once. Moving on, let's say you just moved from out of state and want to see information from your old clinic's MyChart. You can use the Link My Accounts page to create a link to your old record so that you can review prior visits, results, and more. To access it, go to the menu, then search for Link My Accounts. On the Discover tab, search for your old clinic, then set up a link by selecting the Link Account option. You'll be asked to verify your information or enter a username and password to finish setting up the link. Once your accounts are linked, you'll see this icon next to any information that came from another health system. If you need to share your health record, search for Share. From here, you can assign MyChart proxy access to others. Just provide their contact information and what type of access they should have. They'll see your authorized health information when they log into their MyChart. If you have proxy access to another's health record, you can see their information right alongside yours in your health feed. It's organized and color-coded, like this. Use the button here to swap between records. Back on the Sharing Hub, directly release your health data to any provider with internet access, no matter where you are, using Share Everywhere. The provider is sent a one-time code to see your history, medications, allergies, and more. As a patient, one of the most important things you can do is prepare for the unexpected, regardless of your current age or life situation. MyChart can guide you through this using the end-of-life planning activity. I'll search for it from the menu. In the event that a family member, doctor, or other designated healthcare agent needs to act on your behalf, you'll want your preferences clearly documented. Here you can use a question and answer format to record your decisions and preferences for medical and end-of-life care, and can request a visit with care coordinators to talk things through. If you or your care team want to track your health goals or needs, let MyChart be your care companion. Let's say that you're trying to focus on improving your health based on a recent diagnosis. MyChart can remind you of the tasks you need to do each day, like exercising or getting enough sleep. You can also create your own tasks with reminders. Before we go, I want to point out that I've used the menu to search for a few of these activities, but there's so many more available. Your MyChart homepage will highlight features here, but you can also explore what's available from the menu. Thanks for watching. Many of the features shown in this video have their own tutorial. If you want to learn more about MyChart, check out our other videos.
All right, so that was a lot of information in a short amount of time, and I totally understand that. But I thought it gave a great overview and some tutorials on all the different things, and there's still more than that of things that you can do in your MyChart account. I know everybody was encouraged to bring their either iPhone or tablet or whatnot, but I'm more than willing to help anybody today with any troubleshooting, so I can be here for another 15, 20 minutes and help anybody out that would want some help. I don't know if anybody has any questions that they want to run past me. Yeah?
I think to assume that everybody, especially at the age of many of us here, has an iPhone or an iPad or a computer or a smart whatever, is wrong.
Right.
I don't, because we don't all have them.
Correct. And that's
Some of us don't even want them.
right. And that is totally fine.
I'd rather speak with my doctor.
Exactly. And that is definitely something.
And it's a little scary if you're not medically oriented. In my, I'm being very personal.
That's good.
I don't mean to be, except that it scares the out of me.
Mhm.
When I look at something like that, and it says abnormal.
Of course, right, and and MyChart might not be for everybody, and that's totally fine.
I think we just should learn, don't look at it. And I've learned now, I don't look at it.
Yeah, it is hard. I know in MyChart now they are releasing people's results before the doctor sees them, and that is frustrating and scary at times. So I agree with you, and if MyChart is not for you, that's totally fine. You can definitely call our office and talk to one of our nurses, and they can have either the provider or talk you through whatever is going on. I completely agree with that. Yeah, of course, yeah. Any other questions or, yes, sir?
I used to use my chart all the time, but recently it has gotten completely different.
It has.
They want, I don't have a cell phone.
Mm-hmm.
And they want to send a code that I have to type in. Well, I have to go from one room to another because the computer is in a different room than my telephone.
Right.
What do?
It's,
I can't use it anymore.
yeah, it can be frustrating. Technology is always,
It's not only frustrating, it's impossible.
right. And I other than sitting down with you and trying to help you with that and seeing what's going on,
I told you already what's going on, but I have to put this code in.
right, that comes from,
That was not previously.
yeah, lots
So
of,
that's for security purposes, for your security, so your information is safe. With all of the things going on in the world with people hacking and getting in and stealing information, the system felt like we needed to encrypt your health information, and you've got personal information in there as well. To help keep that more secure, there is another step that has to take place, but I'm sure we can work with you in your apartment and try to figure that out. I know Bob isn't here today, he's out sick, but he's great at helping to figure out how to help you be able to use your equipment so that you can get into MyChart. So we can follow up with
I
you.
guess one solution would be for me to get a cell phone.
But you know what? I don't blame you. I don't blame you. I don't want one either. Some days I'd like to throw it right in the bag. Yeah.
There's no way I can use my chart now.
So maybe we can have one of the team help you out. Nope, I didn't want to take your
no,
spot.
no,
I
you're
thought I'd jump
okay,
in to
that's
help
okay,
you, Sarah.
thanks. Go ahead.
Perhaps you're going to say I should have used my chart, but last Friday afternoon and last Monday morning, I called the number of the hospital to ask a question about, do I need to make an appointment to get a blood drawn?
Okay,
Neither of both those calls I got an automated voice, and neither of those calls was returned. I finally just got the time to the hospital. Can you do something about it?
That's a
Yeah.
great question. Maybe you and I can have a chat, because I'm not sure what number you were calling, and you should get a return phone call, and I
For
know.
sure.
So a couple of things. One is, unfortunately, the way of our world, which I don't like either, and I know my 90-year-old mother doesn't like it for sure, because I hear about that. But you should get a call back. So I'm curious what number you were using, and we can touch base on that.
Number on a card, but my card is really old.
Okay. So, yeah, because I'd like to help solve that. And then the other side of that is we are working towards a whole new phone system, which hopefully will alleviate some of the issues we've been experiencing with our phone system, but we're in queue to get that changed up. But I think maybe we can touch base on what number you were trying to utilize. Because you shouldn't have to make an appointment to go into the hospital to get your lab, but the outpatient lab is only open certain times of the day, and we can get that information down here so you all have it available to you. You're welcome. Yeah, back there and then back up
Yeah,
here.
I just want to point out if sometimes you go to your MyChart on Google, the one-time code, and you can save your password, and it's going to recognize you, and it's going to pull it up every time. So if that is Google or Google Chrome.
You can also do facial recognition.
Yes.
for sure.
So that's why I think maybe if there's individual concerns or issues with the code, that Bob or somebody that can come in and help you, because you can do it that way, Mindy's right, or you can have facial recognition. So there's other ways of getting around the code issue. Just to it keeps it secure like we want, but it also makes it easier and more user-friendly. Yes, ma'am.
This isn't about my chart, but it's about security and personal information. I recently, in fact, I think the situation's been resolved as of this morning, but I recently had my EOB for the month of August, and on it was a charge from a doctor I've never heard of, a procedure I never had, and it was all under my name and my Anthem Medicare number. I did call them this morning, and they
Got to do with Bill.
It's something on your bill.
Or an
So-
estimate of benefits or
Estimate of benefit,
explanation of benefits.
which came from your insurance carrier?
Yes,
Yes.
right. I just point that out because I think it's of concern and everybody should be always looking at their.
Always looking at your.
Always.
That's right, because you never know. We just had an example of, and we shared it yesterday at the board meeting for the organization, was a board member, under his name, his address, all his things, went to another board member asking for help with money, getting transferred and all kinds of things. And it looked very legitimate at first pass. Savvy enough to know that it's probably some kind of a scam, and shared it with IT, information technology gurus. But it's very scary. It's constant. Whether somebody's trying to call you and get you to say something, or give them information, or email you, or send you something in the mail, it's something to be very, very aware of. And when in doubt, never return the call, and ask somebody for help to navigate it.
Does anybody else have any MyChart questions, or? Yeah,
When I do get that code, it says it's going to be good for 10 minutes.
yeah,
It's not.
I know.
You know.
I wish I could fix all the technology, I know.
Now, unfortunately, so we think we might have a couple ideas for you, so we'll circle back with you to help
My
you.
idea is to stop at my chart.
Or that's another option for sure. You don't have to.
There you go.
don't have to use it. It's just an option.
Did you have,
Is that?
On a positive note for my child, sometimes you just want to get to your doctor, and you cannot. You call and get the local operator picks up, and they won't put you through. But on my chart, when you go to messages,
Welcome to MyChart, where you can access and share your medical records, make appointments,
Turn that off? Oh, there,
but I
sorry.
get like instant recall, and it's really helpful.
I'm glad that it works for you, and that's wonderful. That's wonderful.
That is
So,
a great resource. Using the ability to message your provider.
For
through
sure.
MyChart is a nice feature. And they are very responsive. I don't know when they sleep, to be quite honest.
They don't.
I don't, some of them do.
yeah. Well,
So hopefully we were able to answer some of your questions.
Yeah.
I want to thank our team for being here today, and we will have more information for you at the next meeting. I did notice, because I was perusing all your interesting information on the wall over there, that the calendar did say that we would have Patty Biocchi here on your calendar that gets distributed here in the building. Patty Biocchi is our new MaineHealth Chief Operating Officer for post-acute care, which is all the newfangled terminology for where you live, and the Zimmerly Pavilion and Gregory Wing. And she's doing a fantastic job. She wants to be able to come and spend some time, and she was not able to do that today with us, and that's why Revenant team had changed up the calendar a little bit here in the presentations. We will have Patty. She is guaranteed that she'll be here, and she's fantastic. I was just talking to Cheryl Woodsbarth a few minutes ago, the administrator here for the facility, and she's looking forward to having Patty come. She spends time. She was just on a meeting with Patty yesterday, and Patty's doing a fantastic job. Her goal is to increase services and capacity for senior living services in all of our facilities, and to help support the team and make sure we can do that. As we know, we've talked about many times here, there's been lots of facilities that have had to close in the state, which is not a good thing. So we want to make sure that we're not doing that. We're doing the opposite. We're increasing capacity for all the levels of care that we know folks are needing more and more today. So more to come from Patty, and I think she's just a very enjoyable person, but extremely smart, and this is her field of expertise. It's all she's done her entire career. And the team is enjoying working with her. So more to come on Patty.
What is her name?
Patty Biocchi.
D-O-T?
Biocchi.
How do you spell that?
Oh, boy. I'll come over and write it on your paper. I'll have to look at it on my phone. I have it spelled differently in my head than it actually is spelled, so I can remember how to say it. It's like Biuocchi, yeah, it's a very long But I'll write it down for you.
Is it possible to show us, and how many pages it would take, an organizational chart like a family tree?
What would you like to see on that family tree?
I mean,
What would you like to see on the
I'd
family
like to
tree?
see from the top down,
So from the MaineHealth system, Andy Muller as
Whatever
Chief
it's called.
Executive Officer?
maybe the current name and the original name, just,
Oh, boy.
you know.
Do you mean local or
Or from Portland?
I'm talking about MaineHealth, I guess.
Sure, we can get you sort of a schematic of what it looks like today. And what I would do is just do it from MaineHealth down through our local area.
Is there anybody about MaineHealth?
No,
Okay. We're the big MaineHealth.
MaineHealth's the big cheese, yeah.
Thank you.
You're welcome. All right, anything else? My chart cards in the back if anybody
do,
needs
yeah.
help. And
Being
thank
here.
you, Mindy, thank you, team, thank you, Sarah. I appreciate all of you being here, and we'll see you again soon.
Thanks for coming.
Thank you.